Have you ever been in that moment of uncertainty, where you're staring at a light smear of blood on tissue and thinking, is this my period, or could it be something else? For women trying to conceive, those few drops of blood can mean everything. It could be the beginning of your next menstrual cycle, or it could be the earliest sign of pregnancy. Yes, I'm talking about implantation bleeding. And while it's often misunderstood, confused, or even completely missed, it holds a critical clue in understanding what's really going on in your body. Hi everyone. I'm Dr. Alina Grace. Today, I want to take you deep into the science, signs, symptoms, and real-life experiences that help us clearly differentiate between implantation, bleeding, and menstrual bleeding. Whether you're trying to conceive, tracking your cycle for health reasons, or simply curious, this video will give you everything you need to know. Because the more you understand your body, the more empowered you are to make informed decisions. Let's begin by understanding what's happening inside the female body in both situations. Each month, a woman's body prepares for the possibility of pregnancy. Ovulation occurs mid-cycle on day 14 in a typical 28-day cycle. If sperm meets the egg within this fertile window, fertilization can occur. Now, here's where things get fascinating. After fertilization, the zygote, now a tiny ball of cells, travels down the fallopian tube towards the uterus. This journey takes several days, and if all goes well, it reaches the uterus and implants into the endometrial lining. This process, known as implantation, usually happens between 6 to 12 days after ovulation. As the embryo burrows into the thick uterine lining, tiny blood vessels may rupture, leading to a light, brief bleed. That's implantation bleeding. It's a normal, healthy part of early pregnancy, and it's often the first visible sign that pregnancy has occurred. Now, let's compare this to menstruation. If fertilization does not occur, the hormone progesterone begins to drop, signaling the body that it's time to shed the uterine lining. That shedding results in what we call menstruation, a woman's period. It's heavier, more prolonged, and very different in its biological purpose. Yet despite their differences, implantation, bleeding, and period bleeding can feel remarkably similar, especially to the untrained eye. So how do we distinguish between them? Let's talk about timing first. Implantation bleeding usually occurs around 6 to 12 days after ovulation, often around day 20 to 26 of a 28-day cycle. That's just before your expected period. Menstrual bleeding, on the other hand, begins right on schedule, typically around day 28. So if you're noticing light spotting 4 to 6 days before your period is due, and you had unprotected intercourse during your fertile window, this could very well be implantation bleeding. But timing isn't everything. Let's talk about color and consistency. Implantation bleeding is often light pink, peach-toned, or brownish in color. It's more like a tint than an actual flow. Sometimes it appears only when you wipe. Period blood, by contrast, starts light but becomes bright red and heavier within hours. It also contains clots and tissue because the uterus is shedding its lining. Implantation bleeding does not contain tissue or clots. And what about duration? Implantation bleeding is usually brief. It might last a few hours or up to 2 days. It doesn't flow steadily. You might see spotting for an hour or two, then nothing for the rest of the day. Or just one wipe of color, and that's it. A period, however, follows a predictable pattern. It starts, flows heavily, then gradually tapers off over 3 to 7 days. Cramping is another point of confusion. Many women feel mild cramping during implantation, but unlike menstrual cramps, which can be sharp, painful, and long-lasting, implantation cramps are more like a light tug or pulling sensation. They're short-lived and not debilitating. In fact, some women say they didn't even realize it was cramping until after they found out they were pregnant. So if you're someone who usually experiences strong period cramps, and this time the cramps are very mild and don't last, pay attention. That could be your first clue. One of the most reliable ways to distinguish between implantation and periods is to look for associated symptoms. Implantation might come with early pregnancy signs, breast tenderness, slight nausea, fatigue, increased urination, or emotional sensitivity. Your sense of smell may become heightened. You may feel unusually tired. You might crave odd food combinations or feel repelled by your usual favorites. These are all triggered by the hormone HCG, the same hormone detected in pregnancy tests. But remember, early pregnancy symptoms can mimic PMS symptoms. That's why timing, flow, and consistency remain critical factors in telling them apart. Now, many women ask, How long after implantation can I take a pregnancy test? Excellent question. After implantation, your body begins producing HCG, but it takes time for this hormone to build up in your urine. So it's best to wait 2 to 3 days after suspected implantation before testing. Most home pregnancy tests are sensitive enough to detect HCG 12 to 14 days after ovulation or around the time your period is due. If you test too early, you may get a false negative, so be patient. Wait, and if you're still unsure, test again 48 hours later. Let's talk now about real-life experiences. I've had patients who were absolutely convinced they got their period only to find out later they were pregnant, and I've had others who thought they were pregnant because of light spotting, but it was just an unusually light cycle. That's why tracking your cycle matters. Use apps. Keep a journal. Know your body's normal. Because when something changes, you'll be the first to notice. Let's walk through a scenario. Suppose your cycles are regular, 28 days each. You ovulate around day 14. You have intercourse on days 12, 14, and 15. Around day 22, you see light pink spotting that lasts a few hours. You feel a dull ache in your lower abdomen, and your breasts are more tender than usual. Your period doesn't come on day 28. You wait until day 30, take a pregnancy test, and it's positive. That's a classic implantation, bleeding story. Now another scenario. Your period is due on day 28. Right on schedule. You feel your usual cramps, mood swings, and then bright red bleeding begins and lasts for 5 days. That's a menstrual period. But sometimes the line is blurry. You might have light bleeding. That starts brown, turns pink, then disappears, followed by heavier bleeding 3 days later. That could have been implantation, bleeding, followed by a miscarriage, or a strange cycle. This is where medical testing helps. Blood tests can check HCG levels. If needed, ultrasounds can confirm pregnancy status. Let's take a moment to clear up common myths. Myth 1. Implantation bleeding happens to every woman. False. Only about 25 to 30% of women report implantation bleeding. Many never experience it tanned. That's perfectly normal. Myth 2. Implantation bleeding is always brown. Not true. While brown or pink are common, it can also be very light red. It depends on how long the blood takes to exit the body. Myth 3. Any bleeding during pregnancy means miscarriage. Absolutely false. Light bleeding in early pregnancy can be due to implantation, cervical changes, or hormonal shifts, but always check with your doctor if you're unsure. Myth 4. You can't be pregnant if you're bleeding. Not necessarily. Some women experience decidual bleeding, a harmless bleed that mimics a light period even during pregnancy. It's rare, but it can happen. Now let's address some acts from women around the world. Can I experience implantation bleeding more than once? Usually no. Implantation bleeding is a one-time event, but some women may confuse other early pregnancy spotting with it. What if I have heavy bleeding, but I'm pregnant? Heavy bleeding should always be evaluated. It could signal miscarriage, ectopic pregnancy, or other complications. Can implantation bleeding be mistaken for breakthrough bleeding on the pill? Yes, especially if you're on hormonal birth control. In that case, tracking your cycle gets tricky. Always confirm with a test. What does it mean if my period is shorter than usual and lighter? It might be an implantation bleed or a lighter period due to stress, weight change, or illness. If you're unsure, take a pregnancy test. What if I spot pink discharge and I'm trying to get pregnant? That could be a good sign. Wait a few days and test. Pink discharge is common with implantation. Let's now talk about other types of spotting that can confuse you. Mid-cycle spotting can happen during ovulation due to a sudden drop in estrogen. This is not implantation, it's called ovulatory spotting. You can also have spotting from infections, cervical irritation after intercourse, or hormonal imbalances. So not all spotting is reproductive in nature. Implantation bleeding has a unique profile. It's soft, light, timely, and short-lived. Combined with symptoms and timing, it becomes a powerful clue in decoding your fertility. Let me share one final real story. A woman named Sarah came to my clinic thinking she was having irregular periods. She had light spotting, cramping, and thought her hormones were off. Turns out, she was experiencing implantation bleeding multiple times because she kept conceiving and miscarrying early without knowing. When we finally diagnosed her with a hormonal imbalance and corrected it, she conceived successfully and carried her pregnancy to term. This shows that even a small detail like a light bleed can unlock a huge diagnosis. So, as we close this video, I want to leave you with this thought. Your body speaks to you every day. Bleeding, cramping, fatigue, these are messages, not mysteries. Implantation, bleeding, and periods may look similar, but once you know the signs, you can tell them apart. Track your cycle. Listen to your intuition. Don't ignore changes. And when in doubt, seek answers. Ask your doctor, because when it comes to your health, clarity is everything. Thank you for spending this time with me. If this video helped you, please share it with a friend. Like and subscribe for more content on women's health, fertility, and pregnancy. I'm Dr. Alina Grace, and I'll see you again soon with more guidance, support, and science every step of the way.